Assalamualaikum and hello everyone. Today we will be presenting about electromagnetism of X-ray imaging. So before we begin, let me introduce my group members. First, we have Daniel, followed by Ardini, and lastly Ain Salwani. My name is Balkis, and together we will explain how electromagnetism plays a major role in X-ray imaging. So moving on, this is the introduction of electromagnetism of X-ray imaging. So electromagnetism plays a vital role in making X-ray imaging possible. It forms the foundation of one of the most important tools in modern medical diagnostic. X-ray machines use electromagnetic radiation to produce high-energy X-rays. These rays can penetrate the human body and reveal internal structure. Because of this, doctors are able to diagnose various diseases and conditions more accurately. The process begins inside an X-ray tube where the electrons are accelerated at very high speeds using a strong voltage. The higher the energy of the X-rays, the more easily they can pass through the different materials. Lastly, this penetrating power allowed X-rays to create clear and detailed internal images of the human body. Next, we will look at the significance of X-ray imaging. So the first significance is to allow visualization of internal body structure. So X-ray helps doctor to see inside the body to understand what is happening beneath the skin. The electromagnetic wave travels through the body and the image produced depends on how much each tissue absorbs the radiation. For example, X-ray can clearly show broken bones, fracture or condition like scoliosis. Next one is the identification of foreign objects in the body. Dense objects such as metals absorb X-rays strongly, making them appear clearly on the image. Foreign objects that are denser than normal tissue, such as swallowed coins, glasses pieces, or metal fragments, can be detected easily through X-ray. This helps doctors quickly locate and treat the problem. Moving on is to improve early detection and care. X-ray provide visual evidence of changes inside the body, such as tumors or infection. This early detection is very important because it allows diseases or injuries to be identified even before the symptoms appear. With this information, doctors can plan the most suitable treatment for the patient. Last but not least, it's important in dental examination. So dentists use X-rays to look for hidden cavities, infections, or other tissues inside the teeth and gums. X-ray gives clear images of areas that cannot be seen through normal visual inspection. So X-ray helps dentists to detect problems early and provide proper treatment.
Now, we will talk about concept of electricity and magnetism in X-ray imaging. Firstly, electricity. How it works. Electricity is used to generate and control the high voltage and current needed to accelerate electrons in X-ray tube. There are two parts in X-ray tube, which is cathode and anode. Cathode is consists of filament like tiny light bulb wire, while anode is consists of metal, usually tungsten. And firstly, electrons produced by heating of filaments by electricity, and then the electrons will produce electromagnetic radiation when hitting the target, which is anode. Then the electromagnetic radiation will transport energy, also called as radiant energy, through space by waves and photons. And lastly, in modern digital detectors, X-rays are converted into electrical signals, then into a digital image. The second one is magnetism, which is magnetic fields can influence the path of electrons inside the X-ray tube, slightly affecting where X-rays are produced. Like in MRI, magnetic resonance imaging, it uses a strong magnetic field and radio waves to produce image. And magnetism is important for controlling the electron beam and preventing distortion of the local spot, especially in environments with strong external magnetic fields.
So here are several word application of X-ray imaging. First is digital X-ray. They are widely used in dental clinic and hospital to detect cavities, fracture, and lung condition. They provide instant image with lower radiation. Secondly is CT scan. CT scan produce detailed 3D image and are essential for detecting stroke, cancer, and internal injuries, especially in emergency cases. Thirdly, fluoroscopy. This technique provides real-time X-ray image and is used during heart procedure, bone surgeries, and digestive system examination. Next, low-dose X-ray technology. Modern X-ray system use advanced detectors to reduce radiation exposure while maintaining high image quality. This is important for routine screening like mammograms and chest X-ray. Then, contrast enhanced X-ray imaging. Contrast agents help highlight blood vessels and organs, making it easier to detect blockades, tumors, or abnormalities. AI-assisted X-ray analysis is also becoming common. AI helps identify fractures, infections, a lung problem more quickly, and supports doctors in making accurate diagnosis. Lastly, portable X-ray machines. These machines are used in ambulance, ICUs, and remote areas to provide imaging for patients who cannot be transported.
Next, I will explain about benefit of X-ray imaging and why it continues to be one of the most widely used tools in medical healthcare. First, X-ray are highly accurate and very fast. They are especially effective in emergency because the result can appear within seconds or minutes. For example, in case of acute trauma, an X-ray can immediately reveal whether a person has a fracture and show the extent of injury. This fast detection helps doctor take a quick action. Secondly, X-ray are more affordable compared to many other imaging models such as MRI or CT scans. Because of this, many healthcare facilities can use X-ray more frequently for monitoring and diagnosis. This makes them accessible and practical, especially in clinics or smaller hospitals. It also allows broader patient access to essential diagnostic service without incurring substantial costs. Third, X-ray are also non-invasive and convenient, meaning that they allow doctors to see inside the body without needing surgery. This reduces pain and lower the risk of infection for patients. Lastly, modern technology has made X-ray imaging much safer. It is because tools like filter and collimator help shape and limit the X-ray beam, reducing unnecessary exposure to radiation. Digital X-ray systems are also used lower dose while still producing clear image. Okay, I will proceed with the challenges that come while using X-ray imaging. The first challenge is the risk of radiation exposure. X-ray use ionizing radiation, and exposure to this type of radiation can be harmful if it happens too frequently. Although a single X-ray examination has a very low risk, repeated exposure over time may increase the long-term risk of DNA damage. This also can lead to mutation and in rare cases, increase the risk of cancer. That's why medical staff always try to limit unnecessary X-ray and ensure patients receive only the amount of radiation that is absolutely needed for diagnosis. The second challenge is that X-ray imaging has limited ability to show soft tissue. X-ray work very well for bones because bone absorb a lot of radiation and appear clearly on the image. However, soft tissue such as muscle, tendon, and internal organs do not absorb X-ray as strongly. As a result, the image of soft tissues may appear faint and it becomes difficult to distinguish between different soft structures. Lastly, the environmental impact of X-ray imaging, especially older systems. Traditional film-based X-ray require developing chemicals which produce chemical waste that can be harmful to the environmental if not handled properly. Besides that, X-ray machines consume a lot of energy, contributing to higher power usage. Outdated machines can also produce electronic waste, which need special disposal method to avoid pollution. While modern X-ray systems help reduce some of these issues, the environmental impact is still something healthcare facilities need to manage responsibly.
Now, we will take a look at future development and innovation that can be applied or exist in this world. Firstly, is AI and machine learning in X-ray imaging. What function of AI? AI can detect abnormalities like fractures, lung nodules, or pneumonia on chest X-ray. And secondly, is portable X-ray system, which is usually used in ICU and emergency wards. It is wireless, it powered by battery, and also have digital detectors that can send image directly to computers. In future, I think maybe we can have even smaller device but better image quality in difficult environments and can integrate with hospital network externally. And thirdly is lower radiation dose. Because we know all X-ray use high radiation dose to achieve a decent image. But right now, we have new X-ray detectors that are more sensitive, so we can use less radiation but provide better image. And lastly, we have from 2D to 3D, and maybe we will achieve 4D X-ray, which is all X-ray just provide a flat image of a flat of X-ray image, which is 2D. But nowadays, we have in CT X-ray tube, they will rotate around body and acquire multiple cross-sectional image of the body, and it can provide a 3D image. But maybe in the future, we can have a 4D imaging, where we can see the organ moving and like the heart or lungs motion there.
In conclusion, X-ray imaging is a vital medical instrument that implements the laws of electricity and magnetism to show the body's inside in a visually clear way. The technique is swift, exact, and non-intrusive, therefore a great rescue in emergency situation for oral hygiene and the early stage detection of disease. However, disadvantages like radiation exposure and limited soft tissue contrast are present. Still, the advancements such as digital system, AI analysis, portable devices, and lower dose technology attract even more users with their improved safety, better image quality, and accessibility. Thus, X-ray imaging is still an indispensable and progressive technology in modern medicine.